Hello, everyone. I'm really excited to be here today. Today we are talking about one of the biggest gaps that I see in health and wellness business space, and that's having the right systems in place so that your clinic can run smoothly. It can run a lot without you as well, and you can grow without all of that overwhelm. But I'm not the expert in this space. So, to bring some clarity into this, I'm joined by Megan from Management on Track. We are so lucky to have Megan today. She's more than 35 years' experience across allied health, medical admin, HR, business operations. She's supported clinics and teams all over Australia and has seen firsthand what works, what doesn't, and just those simple changes that you can make that are going to make all the difference. So, welcome, Megan. Thank you so much for being here.
Thank you. Thanks for having me.
Yeah,
Exciting.
I'm so glad talking to you today and to using extracting all of your wealth of knowledge and sharing that with everyone. So, we'll jump straight into the questions. So, these were the questions. We ran a poll in our health and wellness Facebook group, and overwhelming response was systems. What do I need? What are the essentials? So, going straight into it, for small and growing clinics, what are those non-negotiable systems that should be in place to help everything run smooth?
Yeah, sure. So for me, there's sort of 8 key areas, and they can be as big as you want or as small as you want within those areas. So it's about your practice and your clinical system. So a practice management system is essential. It's your database for all your client contacts. It's got all your billing information in there. It can have automation for reminders, automations for new clients, new client forms. My background, my experience in this has been that, migrating a practice from a very basic system to a lot more expensive system, but more features, and the time saving versus the additional cost was tremendous. So, we reduced admin time. So in the end, it actually cost us less than having the old clunky system with very basic automation and those sorts of things in it. So yeah, your practice management system is first, and a lot of the stuff you can build out of that practice management system with templates, email, SMS, letter templates. There's so many things you can do in there. Next thing is like intake and referral processes and workflows. So last thing you want to do is lose that referral in that you miss it or you put it on a wait list and you forget about it. So it's all those processes around how do I manage my client flow? So, that's initial referral, might be on a wait list, might go straight into allocation to a clinician, letting the client know where they're at. Often the referral doesn't come from the client, it comes from another referral source, and it's keeping everybody informed. One, you keep your referral source until you don't lose those clients. So then you've got your client file structure. I mean, your files are probably going to be electronic, but there are still those key documents, consent and privacy and all those sorts of things. And having all of that in having a set format for what you would put in a client file and making sure you're obtaining those documents and you're keeping copies of them. God forbid you should end up in court over something. At least you've all got it there to carry and find it. And that goes into then your clinical notes, treatment plans and reviews, progress notes, discharge processes, clinical governance policies and processes, particularly if you're in the mental health space and you've got clients that are, ring up in an emergency, and what is your process for your team? How do they handle those calls? And then incident and risk management, if it should come down to that, if something happens and you need to, be reporting that, worst case scenario, police or otherwise. So yeah, that's those practice and clinical systems that, when you get into a situation, you don't have to panic. Everyone knows what the process is and you've got everything in place to best manage that, not putting out spot fires all the time.
Yeah, definitely. And I think with this industry, it is so incredibly important to have all of these systems set up and in place prior to just jumping in, because there are so many legalities around this space that you
Absolutely.
really careful. With the PMS systems, are there some that you love over the others, or is there?
Yeah. No, yeah. Well, the one I've had most experience with is called Prac Suite, and it's very much a allied health database. Is on the expensive side, but as I said, when you look at the time saving in admin and forms and having everything in one place, you can do clinical notes in there. There's automation. I'm sure there's lots of others out there. And I know a lot of people like to use the free versions of things like Galaxy and that sort of thing. But
Yeah.
once you get bigger, you really need to start looking at paid versions because you get so much more. And what you pay is far offset by your time saved and your admin time saved. So, yeah.
Yeah. Would
Yeah.
you recommend starting with the free one? I mean, every business owner
Mm.
has a goal of growth.
Yeah.
I don't think I've met a business owner yet have that started their business and gone, I'm just going to stay really teeny tiny.
That's right.
There's always that growth. Would you recommend going straight to the paid options? Is there enough in those free ones to start even for the 12-month space?
Yeah, oh, absolutely. And I think that they're very much set up for that. I mean, obviously, as a software vendor, they're saying, "Oh, look, use our product for free, and when you find you need more, we'll offer you more, but you'll pay for it." So
Yeah.
that's their kind of carrot to get you in, and a
Yeah.
lot of them are completely fine for that initial setup. You'll have your basic information, your client data. You'll be able to potentially put in clinic notes and that, but it's the features, the automation. It's that next
Yeah.
level that you don't get. Being able to You might be able to have it free but pay for SMSs, but then you go to a paid version, yes, you still pay for your SMSs, but you have more automation around that. So you can set them up to go automatically at 8 o'clock every morning,
Right.
2 hours before the
Yeah.
day of the appointment. So it builds out as your business builds out. So absolutely nothing wrong with a free version, but you probably need to do your homework around which is the best free version. So what beyond that,
Yeah.
you don't want to then suddenly having to be transferring everything into a new database because you
That's what I
find
was
out,
going to ask
yeah,
next.
that free version may not, like Paradise had a little bit to do with Orzander and a little bit to do with Galaxy, but I don't know enough about the paid versions as to how much automation you get and how many features. And a
Right.
lot of them actually then are built to accommodate NDIS in particular, because there's a lot of people working in the NDIS space, particularly
Yeah.
around allied health. So you really need to do your homework, or if it's not your forte, get someone to do it for you, someone who's got some experience. And I've done this in previous projects and
Yeah.
employment where I've actually done the research on databases and said, well, which features do we absolutely need?
Yeah.
Which ones does it give, and what additional does it give? And then you can make your decision from there. Sometimes it'll be based around what you can afford, but it's always
Yeah.
good to be forward thinking that if your intent is to eventually have 6 employed psychologists or
Yeah.
OTs, or to contract them, what am I going to need down the track to accommodate that level of I guess not only staff or contractors, but also
Yeah.
clients and the types of clients that you might be coming through
Right.
your doors.
Yeah.
Yeah. Yeah.
So if you are going to go with that free option, making sure it's
Yeah.
the one that you want long term, because
Certainly, yeah.
trying to do that change
Well, it's
is
time consuming,
yeah.
yeah. So look, it's not that it can't be done, but it's time consuming, and you've got to draw a line in the sand and go, right, I'm stopping this one today and I'm starting that one now. And I mean, I've done that when we've migrated to new databases. It's a lot of work, a
Yeah.
lot of work. So hopefully you can start with a product that's free, but it has that ability to expand to what your intent is in the next 12, 18 months, 2 years, whatever your plan is. Yeah.
Yeah, so that forward thinking with that system will obviously save a
Yeah,
lot of heartache, and probably a lot of
absolutely.
risk too, because a lot of people would essentially, if they're at that growth stage, they are going to be looking to get somebody to do that transition over for them.
That's
So
right. And that can be done. But again, you've got to
yeah,
look at it. You might say, well, look, I'm prepared to worry about that in 12 or 18 months' time.
yeah,
And if it costs me to migrate and have a new system set up, I'll go with it. But
yeah,
it's
yeah,
just something to think about. Yeah.
it's a lot. So we're going to move into more clinics that are in that growth stage. So whether they're looking to onboard more clients, whether whether they've got more admin, they're looking at bringing on new psychologists, OTs, etc., like you mentioned before. Before they hit that stage and hit that go button, what should they be focusing on first so that it just doesn't become so overwhelming behind the scenes?
Okay. So you need to have in addition to your practice clinical systems and that, you need to have your your administrative workflows. Now, whether that be that you're doing all of those and you're going to get an admin person or a virtual assistant or whatever it is you're going to do, or whether you already have someone on your team but you need to expand your team, there's nothing worse than having to sit down and train over and over again. If you can have some documented processes or have someone do that for you, have them understanding what is your waitlist process, what is your new client intake process. And that's pretty simple with your checklist. A new client needs to have this, this, and
Yeah.
this, and having those processes documented. So as you're expanding, if you need to get a new staff member in, one, they've got to learn your database, but then they've got all these procedures or standard operating procedures that say, or checklists that say, for a new client, you need to do this. For an existing client, you need to do
Yes.
this. If it's an NDIS client, then you need to be able to have a service agreement in place, know when it expires, know when their plan expires. It's just all those little things that if you've not got anything in place and suddenly you've got, invoices being rejected here and
Mm.
something going wrong there and you haven't got those initial processes. So it's about having workflows. Financial systems is another one. You should be, I would imagine everyone's got an accountant, but even beyond that, your billing systems, your pricing schedules, think about what it is. Are you going to have one set price? Are you going to have different prices for healthcare card holders? Like there's so many little things in there, but having them thought about and decided before suddenly someone starts asking the admin lady, oh, well, I've got a healthcare card. Do I get a concession? It's all those little things, being really broad thinking about what your business is going to look like. Yeah.
Yes.
Debt
So-
recovery, financial reporting, there's so many things there, but also being across your finances. So if you start employing a clinician and they're only seeing 5 clients a week, you're going backwards straight off.
Yeah.
You've got to think about how many clients do I need a employed clinician to see a day? And how am I going to manage that with DNAs and, failure to attend and that sort of thing. It doesn't need to be huge. You just need to think about those things and then document somewhere about how you want your practice to work.
Yeah.
So,
Okay.
yeah.
Yeah. I
Yeah.
like with
And then,
the SOP. Sorry, with the
yeah,
SOP.
yeah.
Do you recommend that essentially from the get-go is creating those? Because I know I've heard of many practice managers just sort of going, we've needed to bring people on, but I don't actually know. I have to explain, like I said before, you have to explain everything because there's no SOPs in place. So they're not just
Mm.
able to go, here you go, even as something as simple as a virtual assistant.
Yep.
If you haven't got those operating procedures in place, trying to onboard a virtual assistant or an OBM like yourself
Yeah.
is incredibly difficult because you're having to explain everything like
Yeah.
this over the
Yeah.
phone or over a Zoom chat, instead of being able to hand over those
Yeah.
documents.
And it's time consuming. So right at the time when you're trying to save time,
Yeah,
you're suddenly
yes.
spending time. And I think a lot of this, what I do here and what I'm talking about today in general, is about being pre-prepared. You wouldn't start a clinic up, even if it was a telehealth clinic, and have no thoughts about fees and about what your consent form look like, all those
Mhm.
sorts of things. You've got to have those in place, and most would. But it's the same if you're going to expand your practice and bring on staff, allied health professionals, even contractors. So there's a lot of contractor models out there where they work through your clinic, but they work independently. And I can
Yes.
go into more another time about that. But it's about how are you going to do that and explain what their roles and responsibilities are if you haven't even thought about it.
Yeah.
Yeah.
It's all in here, but it's just
Yeah,
not out.
yeah, yeah. And virtual assistants can help you document those processes, even if they don't know your business.
Yeah.
But if you've got a checklist or a basic, even if it's a basic
Yeah.
document, or you've written down some notes and going, this is what I do with a new client, can you put that into a checklist or procedure for me? If you've got a VA that's experienced in that space, like someone like me, I can do that easy, like no worries. So it's
Yeah.
again, be careful about who you pick or who you employ to do that process. If there's something specific you want to do, like creating procedures, get someone who's got a real background in that. And, and that where a virtual assistant might be better than an employee, because you can bring in or contract in the experience you need in different areas of your business. Yeah.
Yeah, absolutely.
Mhm.
And they can, instead of paying somebody full time to do this, you can bring them in on a lot of the virtual assistants that we work with work on our blocks. So
Yep.
you can purchase 10 hours.
Packages. Yeah,
Yeah.
packages even like I do a HR package where I'll do your recruitment or I'll do your
Yeah.
onboarding or I'll develop your key package of HR policies and procedures. So getting someone that can do that for you,
Yeah.
so they can give you, the core, and you can have a look and go, can you now amend that to look, I want to add this or I want to do that and
Yeah.
put it on my letterhead and all of that sort of thing. So yeah, at least you're not doing it all. You'll just hand over, I'll be a
Yeah.
2-page document. Can you make this happen for me? Yeah. Yep.
Yeah, absolutely. And the time and the money that it would cost a clinician to actually do that themselves is that they're
Yeah.
losing money.
Exactly. If you're charging 200 plus an hour or whatever your rate is, and you can get a VA from well, it depends on what you're getting to do. It can be 40 to 80 odd
Yeah.
dollars, but you're still saving money. Whichever way you look at it, you're saving money.
Yeah,
Yeah.
absolutely, definitely.
So,
We've probably touched on this already actually, but you work with a lot of clinics and all the different stages. So what do you think is the most common mistakes that you see practice owners make? And like we were just saying, especially when they're busy or they're expanding and they don't
yeah.
have time.
Yeah. So I think that it's the systems. The systems need to be there. The systems and processes around all the key areas and poor financial visibility. So, when you start to employ extra clinicians, if you haven't already got a good referral base or you haven't already got maybe a wait list of clients, then you're going to be paying out money before it starts to come back in. So
Yeah.
being across that and maybe having, a headset, well, I know for a couple of months, maybe it's going to cost me a bit, but the plan is that eventually, it will start to pay off. So being across it financially might mean talking to your accountant. You might get yourself an online business manager, whatever it takes to help you if you're not, sort of finance savvy. One of the common pitfalls is then your inconsistent client experience. So if you're busy and you're expanding and you're not communicating with your referrers, you're not communicating with your
Mm.
clients, we always aim to contact a client within 24 to 48 hours. We've got your referral. This is where it's at. We'll be back in touch in the next 24 to 48 hours. People will look around. They'll shop around. And that was my
Yeah.
experience. Sometimes 24 hours was too long. If they didn't hear from you immediately and they could get in somewhere else, that's where they went. So if you want to build your business, you've got to be across those referrals, but also your stakeholders. You need to be contacting them and saying, hey, we're expanding. We've got Fred starting next week and he's really good at X, Y, and Z. So,
You're right.
marketing yourself in advance.
Mm.
If the referrals are coming in telling people, yeah, Fred's not starting for 2 weeks, but we'll get you in, we'll book you an appointment, we'll get you
Yeah.
set up. Once that appointment's reserved, a lot of times clients are happy with that. If they don't hear from you, they think, oh, you're not
Mhm.
interested in me, and they've moved on. So being really, really savvy in making sure you've got the client base, if or you're starting to build that client base in readiness to bring someone on. So financially, you're not going backwards too far.
Yeah, like you were saying that
Yeah, yeah,
they're not
yeah,
doing, seeing 5 clients.
yeah.
That
A day.
yeah.
If you only got 5 a week, yeah, that's a big hole. If it's someone that wants to come on board 2 days a week, that's fine, and they want to
Mm.
build. That's a good plan to have. And saying, well, look, okay, let's come on for a couple of days a week, and once your client base builds, if you're happy to come on for more days and build them that way, that's going to be a two-way conversation, obviously, with
Mm.
whoever's coming on board with you. The other thing is hiring the wrong people, so wrong clinicians, wrong admin team. Be really savvy about who you're bringing on board. Don't just get the first person that applies, and reach out to your network. So if you're an OT, who in your networks know somebody who's looking for work, and getting someone that you know is going to be good for your business, because they're your reputation as much as you are once you start bringing others into the business, as
Yeah.
are your support team, your practice manager, office manager, admin person, whoever it is. But not only get the right people, but start them off right with those systems and processes and keep them, make sure they're informed and make sure they're supported through that journey.
Yeah.
And the other one is compliance gaps. So if you haven't thought about compliance, as soon as you get someone else or another 2 or 3 people that are working under your business and your reputation, if they're not doing the right things, if they haven't got their insurance in place, all of those things, then you start to come undone when things go wrong, and you don't know until they go wrong, and then
Yeah.
you're scurrying. So yeah, it's
Yeah.
it's it's just being ready and being across those things that need to be in place in advance, not after the horse is bolted type thing.
Yeah, yeah,
Yeah,
after
yeah,
the fact.
yeah, yeah, yeah. Yeah.
Definitely. So from all of the different clinics that you've worked with, can you think of one that has just run incredibly well? The systems are you were just in awe and just going, "This is absolutely incredible." Well, even if you've set it all up yourself,
Yeah,
feel free to go,
yeah,
"Hey, I did that."
yeah,
But yeah, like
yeah.
what was it? Like what did it look like?
Okay, so for me, probably one was that came into that had a lot in place, but was then about refining it. In particular, waitlist management. So, well, new referral and waitlist management. So
Yeah.
it's that clear process about when you contact a client, you keep them informed, you follow them up in if in 2 months' time they're still on a waiting list, going back to them, you're still wanting services. So really being across the client journey. There's also an element for the practice owner around clinical risk if you sit someone on a wait list. So if someone's on your wait list, that's well, obviously you wouldn't put a high risk person on there, but if there's any change or likely to be any change, keeping in contact and making sure they're informed. Things like having those standard processes. So, there's always leeway in that. So if a clinician decides they want to give a discount on their hourly fee for whatever reason, it can be done. But it's about having that base processes around everything. Like when do you charge non-attendance fees? How much do you charge? Do you
Mhm.
charge, 50% of the fee? Do you charge 100% of the fee? So yeah. So having all of those little processes in place and having your new team aware of what they are. The other thing too is having where you can team meetings and keeping those clinicians involved with your practice decisions. So it doesn't mean they get to make decisions for you, but it's about keeping the team cohesive, the same as you would with any team.
Mm.
Admin team, what's working really well, refining procedures around that. So I've done, do they need to be that way? Can we refine them? Can we find a system to better manage waitlists, for example? Spreadsheets versus a practice database may have a waitlist management system in it.
And there's all new
Oh,
ones coming out all the time as well
yeah,
that you need to
yeah,
keep
yeah.
across then,
Yeah, but it's
um,
continuous quality improvement. So whether
yeah,
you've got it in place or haven't got it in place, you're constantly looking at it. And that doesn't mean you're sitting down for hours at a time. It just means you go, okay, I'm wondering about this process. I'm wondering about my data follow-up, for example. What are we doing there? What could we do better? If you've got a lot of debtors, what are our timeframes for following up? Most people are payment on the day, but if someone doesn't, how long are we giving them before we follow them up, and putting those sort of processes into place.
mhm,
But yeah, I think there's so many things. It's just about being across them and about feedback on those processes. Even you can go as far as surveying your clients if you wanted to. People
yeah.
are surveyed to death, but you might have some clients that want to give you feedback on how the first experiences were for them. They're all things that help you provide a better service.
Definitely, and I think the surveys, especially at the start, are incredibly vital to for your growth and to because what you think your client wants, it may not be it. We a lot of us just assume in the business world that this is what because that's maybe what we want. And we've sort of I've done surveys myself across the health and wellness business owners and freelancers like yourself. And what I thought everyone wanted was actually not the top priority. So but yeah, without the surveys and without people contributing, I would never have had any idea. And I think, if you are in that growth stage, potentially before you even hit that growth stage, is to put it out there and go, what do you want to see? If we did this, is this good? What else would you like to see? Is this important to you? So
Yeah,
that,
getting a feel for their experience and what would have made it better, all of
yeah,
those sorts of things. Yeah. And there's one other thing that with all of this we've been talking about today, which no one probably ever thinks of, and it's called a practice continuity plan. So what happens if you as a clinician becomes incapacitated or at worst has an accident and can no longer work, deceased? What's going to happen? Who's going to tell your clients that you're no longer here or able to work? Who's going to take over your clinical records? All those sorts of things. Now, how is that going to be managed? Now, when you're a sole practitioner, that can be really difficult. It might fall to your husband or partner, or I don't know, you might get someone you've a trusted colleague that you've given that delegation to. Obviously, they need to agree to it,
yeah,
but then you need to have the processes, the information systems in place for someone to carry out your wishes. Because if something happens and client wants their clinical records, or you're partway through therapy, who's going to pass that
Yeah.
information on? So it's one we don't. It's a bit like, I guess, doing your power of attorney or your will. You don't really want to do it, but
No.
as a health practitioner, you really have to think about it. And there's a lot of information out there about what that could look like. And it doesn't
Mhm.
need to be huge, but it needs to be a consideration of your practice, that you've got responsibility for all these clients. What's going to happen if I can't come to work for 6 months
Yeah.
or at all? Who's going to tell them?
Yeah, wow. Yeah, and
Mm,
I don't think that's something I probably would have even thought about either,
mm,
to be
mm,
honest. It's
mm,
yeah, it's like you said, it's doing your will, it's those
mm.
itchy things, but
Yeah,
you need to do them, like you said.
yeah.
And that's something that you can help the business owners with.
Yeah, yeah,
Getting
absolutely, yeah. And it really builds into your clinical governance and clinical compliance. It's
Yeah.
an element of that you really should have something in place. Yeah.
Yeah, wow. That's an incredibly powerful reminder, I think, to finish our interview off. Thank you so much, Megan. Yeah,
You're
I
welcome.
know these insights are going to be incredibly helpful for all of our clinic owners. And you have a follow-up, I suppose, to what we've discussed today regarding the systems. So Megan's got an essential systems checklist. That's right. Yep.
Yep, correct.
Did you
Yep, happy to
tell
share it. And it probably looks daunting when you look at it, but it's just the things you really need to consider. You may not want them all at once, but there are things there to consider. And yeah, I love this space. I'm really passionate about it, and it's not about me and my business. I just love to see businesses grow
Mm,
and do well. And these things that are daunting and just not in some people's space to even think about is something I love doing, as do a lot of other VAs
yeah.
and online business managers. And there's help out there. And like, I have an absolute passion for it. So if anyone wants a copy of the checklist and has questions, I'm happy to do a free half-hour call with someone and have a chat more about it and drill into it. Absolutely happy to do that. Yeah.
Yeah, that's excellent. And I will share all of the links for that checklist as well as the 30-minute call with Megan if you wanted to have a chit chat about the systems that you've got in place. But yeah, 100% it can be overwhelming and daunting, but but that's why you're here as
Yeah.
well, to
Yeah. Yeah.
remove that overwhelm. And because,
Yeah.
yeah,
Yeah.
it's a lot.
That's right. And look, my 30 plus years of experience in anything from finance and banking to audits and compliance and accreditation, it all feeds into this. So for me, this is not overwhelming. And there'll be a lot of other VAs and online business managers out there that are exactly the same. They might not do it all, but they might do portions of it. There's help out there. You don't have to do it yourself. You just need to be aware of what it is you should be thinking about, particularly
Yeah.
if you want to be successful and grow your business. Yeah.
And getting that help, like you mentioned on earlier, getting that help that has that industry experience, I think is so important in this space because you can just hit the ground running.
Yeah.
You've got that experience, you've got that knowledge of the industry that allows you to hit the ground running. And that's so important. It's, I suppose a lot of other industries don't require, I suppose, all of the regulations
Yeah.
that we need to know about. So
Yeah.
having,
A lot bigger, a lot higher level, and a lot more clinical governance, clinical compliance, and just the fact that you're dealing with clients in the health space, the repercussions if something doesn't get followed up or followed through. Yeah, there's a lot of responsibility on all health practitioners. It doesn't matter if you're an OT, a
mm,
psychologist, a doctor, a psychiatrist. There's that level of a responsibility you have. Hence why I mentioned the practice continuity planning is because, if you, I guess, run a financial advisory service and then you don't come to work anymore, someone can come in and easily take it over. That's one
mm,
client. But you as a health practitioner have multiple clients and GPs and everyone else that wants to know what's happening with a client. If you're not here to give that information, what's going to happen?
yes.
So important. Yeah.
Yeah, that was an incredibly good reminder to all of us, I think. Yeah, thank you again, Megan, so
You're welcome.
much. It's been a wonderful chat. And yeah, we'll talk to you again soon.
Thank you. Thanks for the opportunity.
Thanks for that. Bye.
Bye.